Do you frequently feel like your heart is racing, or you get bruises so easily, even from a small bump? What if your child gets sick every other week from simple infections, like colds or earaches? Imagine their skin often breaking out in rashes, like eczema, and tiny red spots appear under the skin without any injury. These might not just be small health issues. They could be signs pointing to a rare condition called Wiskott-Aldrich syndrome (WAS). It mostly affects baby boys and weakens their immune system and ability to form blood clots. Think of it like a broken security system in the body. Germs get in easily, and the body can't stop bleeding quickly. It's rare, but understanding it early can help families take better care and improve life for affected children. So what causes this broken security system? Wiskott-Aldrich syndrome is caused by a tiny mistake, like a typo, in a gene called the WAS gene. This gene is like a blueprint that tells the body how to make a special protein needed for white blood cells and platelets to work properly. If the blueprint is damaged, the body makes little or no working protein. And that's a problem because white blood cells fight off germs and platelets help your blood to clot. This gene problem is passed down from mothers to sons. Moms can carry it without being sick, but their sons might get the full disease. Think of it like a faulty app on a phone. Even if everything else works, that one app keeps crashing. In this case, the app is the immune system and clotting system, and it just won't run right. Let's say a 6-month-old baby named Tom keeps getting ear infections, and every time he gets a small cut, it bleeds for a long time. His mom also notices many small red or purple spots on his arms and legs. Those are called petechiae, caused by low platelets. Tom also has eczema, with dry, itchy patches on his skin. Other kids might play and fall without issues, but Tom ends up needing bandages often and doctor's visits. As he grows, he may develop serious infections like pneumonia, or even have a higher risk of blood cancers. Parents often ask, "Why is my child so sick all the time?" The answer might lie in the triad of key symptoms: easy bleeding or bruising, frequent infections, and skin rashes. If you notice all three, it's very important to talk to a doctor. First, they will check blood under a microscope. They look at the size of platelets. They are usually very small in Wiskott-Aldrich syndrome patients. Then they test the immune system. Are white blood cells responding properly? Genetic testing can confirm if the WAS gene has a mutation, like checking the faulty blueprint. Once diagnosed, treatment starts. For bleeding, doctors may give platelet transfusions, like adding backup clotting helpers. For infections, antibiotics or immune globulin, a shot of antibodies helps strengthen defenses. But the only full cure today is a stem cell transplant, if a match is found, like from a healthy brother or donor. It is like replacing the entire broken security system with a new one. If transplant is not possible, care focuses on preventing infections and managing symptoms carefully. Can we stop Wiskott-Aldrich syndrome before it starts? Since it's a genetic disease, we can't prevent it like a cold, but families with a history can get help. Genetic counseling is key. Think of it like a family health map. Doctors check parents' genes to see if the mother carries the faulty WAS gene. If she does, future pregnancies can be tested before birth to know early. While we can't change the gene before birth, yet knowing the risk helps families prepare. For now, prevention means early detection, avoiding injuries, keeping vaccines up to date, but not live vaccines, as they can be risky, and quick medical help when sickness hits. You can't stop the typo, but you can catch it early and protect the child better. Exciting things are happening in science. Researchers are working on gene therapy. Imagine fixing that typo in the blueprint instead of replacing the whole system. In some recent trials, doctors take the patient's own stem cells, fix the faulty WAS gene in the lab, and put the corrected cells back. It's like editing a document instead of buying a new computer. Some children treated this way have shown strong immune recovery and fewer symptoms, with no need for a donor. Also, better gene editing tools like CRISPR are making these therapies safer and more precise. While still not widely available, these advances give real hope. A future where every child with WUS gets a personalized cure, not just treatment. Science is moving fast. Today's lab test might be tomorrow's life-saving fix.